Hello, aquarium fish keeper. Today we are ready at the fish disease case number 34. It's about the silver shark from Colombia, which is a special fish which is kept by many aquarists, particularly in the United States and Asia. They like a lot this kind of Arius SEEMANI, the SEEMANI shark. And I will show you my my PowerPoint to explain you, well, what's about this case. The new name of this fish is Sciades SEEMANI, or Arius. It's the Colombian shark or silver shark from Colombia. And here we found a gill fluke infection. Well, luckily these are easy to identify diseases, but here we found some complications which are interesting to mention. The fish, first of all, we saw them behaving in the tank in an abnormal way. They were getting skinny, and you will see that some will start to scratch against the surface. Look at that. Look here on this fish, how he's scratching with the side of the gills. I will show you again. And this is a typical sign that something is irritating the fish. Look, that he is suffering from something that is, well, itchy. It's an itchy behavior. He's scratching. So if you observe this, you might suspect the way he was doing that there's something is wrong in the gills. And well, that's what we found in the gills. We found some large gill flukes, which are luckily easily to observe, even with a smaller magnification, 50 or 100. You find these big gill flukes. Yeah, what type it is, I don't diagnose all the different types because there are so many different types of gill flukes, not only ductile or gyrus, but many other ones. But at least we know it's a gill fluke, and then we know what to look for. Some are moving around. Yeah, that's what gill flukes do when they are not happy to be in the slide underneath the microscope lamp. They start to move around and try to get away. So in certain fish which are dying, sometimes the gill flukes escape and are leaving the fish like rats leaving a sinking ship. The problem that these gill flukes can cause is, look, lesions at the gills, damage of the gills, and this is a risk that there is an intrusion, infiltration of bacteria, and that can become a bacterial infection, and that destroys the gill tissue. And this might cause like pneumonia or gill diseases with bacteria and deteriorating the gill system, the functioning of the gills, and the fish might eventually die from this problem, the gill bacterial infection, not the flukes. Here, more progressed, badly damaged gills due to bacteria, which were damaged by the flukes. And so there was an infiltration chance for bacteria. So that's something you have to think about. When you have gill flukes, you might have a risk of bacterial infection. Also on the skin, we found those kind of colonies of bacteria, all those black balls here. Those are all thousands of bacteria, sphere of bacteria. So this is also could be the cause of the secondary bacterial infection. And this is something you have to worry about, and you might see him moving around, trembling on the spot. Hard to see. You need a special high definition microscope of that, and that's not so important for us to see what kind of bacteria. You will know. You will still need a laboratory to identify the bacteria, but still, what you have to think about, you have to apply an antibacterial treatment, and most likely a broad spectrum antibacterial treatment, because a laboratory costs money, takes time, 2 to 3 days, and then maybe you know it, but your fish might be dead by then. Also, checking this Colombian shark, which is a wild fish from Colombia, we find quite often worms. And here you see a nematode, which is nearly encapsulated. And the encapsulation process is done by the fish. It's a defense system of the fish that he, when he is healthy enough, encapsulate the worm, and the nematode will become less effective and less risk of spreading diseases to other fish. So when it's encapsulated, no treatment is possible. And in this case, with this fish, we only found one nematode, but we found the gill flukes and the damaged gills. So the thing you have to think about is treat as soon as possible. Treat as soon as possible and avoid overcrowding. So maybe spread out the fish. When you have a black shark in your fish tank, doing this, take it out of the tank if you can and put it in a separate quarantine tank. Add sea salt, 3 to 5 grams per liter. This helps to control the growth and the multiplication and the reproduction of the gill flukes, because the gill flukes lay eggs. The eggs, after 7 to 10 days, babies comes out, and the gill, they don't like the salt. It will give a bad impact on reproduction and on the growth of the babies. Use an anti-fluke medication, follow very well the directions, because you need several treatments, particularly when they lay the eggs and they come into the filter and in the sand of the water, and after 7 days you have new baby worms coming out. Salt helps, the anti-fluke medication. I can also recommend to siphon off the bottom 2 times a day, so you can remove the possible eggs or the parasites which might have dropped off and floating around. So this is a physical action you can take as a hobbyist to avoid more spreading of the disease. Try to think about at the same time using an antibacterial medication to control secondary bacterial infections. Medication like Viromor from Aquarium Munster is like a good disinfecting, controlling the bacteria which are sitting on the gills and the skin. So Viromor is a possibility from Aquarium Munster, but there are many more other medications you can get, of course, depending what is carried in the pet shop you're dealing with. Anti-fluke medications, there are many different kinds. You have Dactimor, you have Dacticid, you have, well, so many. Ask your pet shop for advice. And as a last good resort to help your fish to defend themselves against parasitic infections like gill fluke is our feeding program for at least 20 days with Dr. Bassleer Biofish Food Garlic. We have specific garlic which is freshly minced and coated on top of the granulates. It's not cooked, and it has a very high content of anti-parasitic materials. But the fish have to eat it properly, eat enough, and not feeding any other food. So he has enough of the garlic absorbed. The allicin, which is the product of the garlic, helps the skin, the mucus of the fish, to become, how can I say, not a likely place for the worms to sit on. So this is all opportunities you can do as action to treat your silver shark from Colombia for this gill fluke. But you have to take actions. As the sooner you can do it, the better you will save your fish. So thank you for watching this this video. More to come in the coming weeks, so stay tuned, and we hope to keep you updated about becoming a good fish doctor. Thank you.